Good day, everyone. I guess you're having a wonderful time in your homes and wherever you are right now. I'm in the House of Faith and you're watching Nysc Digest. In today's program, you're actually seeing what's happening here. We are covering the medical CDS outreach event. And we are going to go around, talk to them. We want to know what is happening here because a lot of persons are coming which are beneficiaries of what the medical CDS actually brought to the people, giving them free consultation, free tests, free medical attention, even free health education. So, but before then, let's take a short break. We'll be back very soon. Welcome back. As you can see, or as you know, community development services is actually the core member contribution to the very state of assignment. So the medical CDS group, they are actually making their own contribution to the development of Niger State. So that's why you can see them putting this up together. Right now, so we are in Kure Market here in Minna. And we are here actually to cover the event as people coming to actually benefit from what the medical CDS has brought to them as part of their contribution to their service in Niger State. So let's just follow us as we go on in the program. Trust you enjoy it. Medical CDS call member. So please, can we know your name?
My name is Dr. Khadija Abubakar Magaji.
Okay. Please, concerning this medical outreach, can you tell us maybe your role, what you're doing, and how it's going?
Well, I'm actually a dentist. I'm a dental surgeon. So, but basically now we have a lot of doctors handling the situation. So I'm just helping other people organize the people and make sure they go from one station to another accordingly. And also the entertainment, which is yet to come, I'm handling that too. Okay. So welcome to our outreach.
All right, thank you. So how can you explain what has been happening so far? Is it meeting up to expectation and the stress? Have you been able to manage it?
Well, when we first came, it looked like nothing was going to happen anyway. But at the long run, we are getting more than we expected. Okay. I mean, the amount of patients we're having, the numbers we've given out is almost like 100 and something already. Seriously? So we've had a lot of turnout and it's going on well for now. We're managing it well. So,
thank you very much.
I thought I 61. Next person, 62. 62, go there.
You're done. The nursing session. And let's have one of them talk to us about what's happening here.
My name is Nnamdi Onokala, and this nursing section, we take the vital signs here, like the blood pressure and the beats per minute. That's the pulse.
Okay. So the device you are using, is that what you are using for it?
Yeah, this FIG, the BP apparatus.
Okay, so has been the response so far? Yeah.
The turn up is nice. People are really turning up for the sensitization and the service, the medical service.
Okay, thank you very much. Consultation unit, and you have the doctors here attending to people who have some issues and need some advice. So let's talk with one of the doctors concerning what happens here.
Okay, basically we are running a medical outreach for people that are present in the market today. So various people come. It's a free medical outreach. So some people come for just general medical checkup. Some have complaints to render. So we listen to their complaints, we send them for the relevant investigations, and we will prescribe drugs as necessary, as required. Sometimes some may need to be referred for specialist care. We also do that here. And just to create a general awareness on any medical issues they might have and help them relieve any problems or concerns they might have. So everything here we're offering here is free of charge, and it's by our CDS, the medical CDS. So that's what we are doing here.
Okay, thank you very much. Are you also doing health education, right?
Yes.
Okay. Please, can you give us a brief of health education so that for some other persons that aren't here, maybe the issue you tend to encounter more here, maybe you could just enlighten on it a little.
Well, there's a general health talk, and then also there's a specific and subjective health talk. We give them general health talk on issues about things, concerns of like malaria, sexually transmitted infections, and things like family planning, other things. But on a one-on-one basis, depends on the particular concern of the patient or what the patient might have. You see, patient who has a high blood pressure now, you know the relevant advice to give to that person as regards this peculiar problem. Same thing for people who have diabetes or any other concern. You know how to counsel them accordingly. Generally, we know what the most common medical concerns. We have malaria, we have HIV, all these things. Counsel them on protection, counsel them on protecting themselves from mosquitoes and all these other things. And then general hygienic practices that can help them live healthier lives.
What have been the challenges so far you've been encountering for the meantime?
Well, the major challenge is the language barrier. Yeah, that's the major challenge. So sometimes you just have to just approximate what you feel the person is saying, the general thing. You may not get every intricate detail, but you work with what you feel. They say there's a fee and chill on K, you just know, okay, headache, but you may not get everything. But whatever you can get, you work with that. So we have interpreters, but they are not as many as we would need, and they may not. Some things may get lost in translation. So, but that's just the basic challenge we're facing.
This is the high session, and we have the doctors here also attending to the people. So let's have a doctor talk to us. Please, what's happening here?
Okay, we are carrying out free medical outreach, the medical CDS of National Youth Service Corps. We're here at Kure Market here in Niger State. Okay, so we're carrying out medical outreach for the market people.
Okay. So how does your profession come in?
Okay, I'm an optometrist by training. So right now we are examining the eyes of the market men and women to know their visual needs and also provide the little solution we can.
So I can see some eyeglasses. Do you give them free too?
The eyeglasses not actually for free, but it's highly subsidized. What we give for free are the drugs. The drugs are for free, but the glasses are highly subsidized. Those ones are not free, yes.
Okay. Attending to their high issues and many things. So what have been the challenges so far in this high checkup?
There are no major challenges, just that actually we are not doing an in-depth examination whereby we have to examine the inside of the eyes using eye gadgets and the rest. All we are just doing is just the visual acuity test and to know if they will require glasses for reading at near. That is what the basic test we are doing right here.
Okay, thank you very much. So when you encounter serious issue, do you get to refer them also?
We have to refer them to the general hospital or other tertiary institution for further examination and treatment.
Okay, thank you very much. You can see the eye doctor doing the work, and an interpreter is actually helping out, which has been the major challenge here. It is the medical section, and we have Dr. Philip here. So let him tell us what happens in the medical section. So Dr. Philip, please, can you tell us what happens here?
Okay, this is the medical section where once they've taken their vitals, they send them here for consultation. So the doctors here actually get to know the complaints that they have. Haven't heard about the complaints, just take a quick history from them to have an idea of what could be wrong with them. Then by the time we diagnose them, or if we are in doubt, we could from here send them to the lab session for them to go and do a test. Then bring it back for us to confirm the diagnosis. Or if we are sure that that's what they probably have, we just diagnose them, then write drugs for them. Then from here they move over to the pharmacy. But for some that might probably need some advanced care or some level of care that we might not be able to offer in the outreach, we also could refer them from this point too. So it's actually more of a consultation point and a treatment point for most of them. But if it's an advanced case, then we refer them to maybe general hospital or other places that they can have some higher level of care.
Okay. So you said it's a consultation point and a treatment point. Can you expatiate on it? Sorry.
Okay, consultation point in the sense that normally now when patients come, they come with complaints. So when they have complaints, they meet a doctor to know what is actually wrong with them. Okay. So we actually give them some form of consultation by doing that. Okay. In the sense that we actually try to talk to them so that we can get a diagnosis. We actually treat them based on what is wrong with them, and It's when we actually can diagnose them, we can now treat them. So we consult them by having interaction with them to know what's wrong with them. Then we now diagnose them of what they could actually have. Then we treat them based on the diagnosis. So for example, if the man actually complains and he has something that is suggestive of malaria, and we are sure, okay, this is malaria, we probably send him for a test to confirm malaria. If the test comes out and it's positive, then we are sure that, okay, it's malaria the guy is having. Then from here, we can now send him to the pharmacy with having written some drugs for him to take so that he'll be okay.
Wow, that's really amazing. Okay, what have been the challenges you've encountered so far?
Oh, major challenge is language barrier. Major challenge, language barriers. Most of them just speak Hausa, and for some of us, we were posted from other states. So it's not really easy for us to be able to really catch up with the language like that. But fortunately, we have some people that actually help us to interpret the Hausa language. So we still find a way to. Then secondly, too, it's not really easy for some of them. Even when you try to make them understand, it's not still easy for some of them. For them to be able to know how to go on with their drugs, but we are trying to make the world we have anyway.
Okay, thank you very much. I know it has not been easy so far. So, but have you been able to manage the different people? You know, there are different individuals, there are differences. So, have you been able to manage it so far? And how do you get to talk to them and relate to them easily?
Well, truth is that even though it's a market setting, most of them are not actually illiterate as they actually look. Some of them have some level of education that they have actually had. They can read, they can write, they can communicate. So for some of those ones, we just probably tell them what to do, and they go on with it. But for some other ones now, like some Almajiri children that came not too long ago, those ones now we have to address them as a group. At least someone that could speak answer, address them as a group, and then we treated them as a group. So that's one of the things that we just have to apply to.
Okay, this is the BMI section. Please, can you tell us the meaning of the BMI?
Body mass index.
Okay, so how is it done, or what do you do?
We'll check their weight and their height, then we'll divide it.
Okay, so what do you use for the weight and the height?
We use the scale there, and we've already measured the distance there. You understand? So we just go there, we check for their height, then we'll know the distance. Then after we'll now refer them to the doctor. Those.
Okay, please, what's the relevance of the BMI to the medical outreach?
Actually, the relevance is just to know if the individual is obese or underweight or normal weight. That's the essence of doing the BMI. So you know if the person is obese, that is obesity, or is normal weight or underweight. That's just the essence of the body mass index.
All right, thank you very much. So what has been your experience so far in this section?
Experience like nothing much, just doing the normal thing. So far, we've gotten so many normal weights. So far, so just okay, normal.
That's nice. So has it been able to meet up to your expectation, or there's something else that it was beyond what you expected or planned for?
No, nothing more. What I'm seeing is what I expected actually.
Okay.
So yes,
wow, that's amazing. Thank you very much. Please, what's the name?
Jemima.
Okay. Please, which session is this?
This is the laboratory section where we do tests and other investigation, test results and investigations.
Okay, wow, that's amazing. So how's the work been so far?
We're quite busy, as you can see, but we are trying our best to make sure that everybody is tested as the investigation is being asked of us to do. So we are trying our best to do the tests.
All right, thank you very much. How has been the response so far?
Quite encouraging.
Okay. Yeah. Amazing. So what have been the challenges? I believe being here, doing this, the stress and many other things. So what has been the major challenges?
The challenges is that some, due to the test they got them to do, they might not like to do it. Some said it's personal, so we just have to leave them. It's not force. We can't force them, like HIV test. Majority kick against that they won't, so we can't force them to do the test.
Okay, but it's part of what is relevant for your medical outreach. So how do you intend to go about it, leaving them just like that?
So we take them back to the person that wrote the test for them, like the doctors that prescribed we take them back to them and tell them that this is what is going on. So they go back to meet them for more cancellation and other things like that.
All right, thank you very much. Really appreciate it. Okay, thank you. This is the pharmacy team, and here with me is Dr. Emmanuel. So he's going to be telling us what happens here. So please, can you tell us what you do here?
Okay, basically this is the last portal of exits. After they come through the entrance, they meet the doc. This is the site where they get their medications before they leave. So what we have here are the various medications, from the anti-ulcers, the omeprazole, the antacids. Then we have antibiotics like the ampicillin, ciprofloxacin. Then the analgesics like the paracetamol, NSAIDs like diclofenac right here. So depends on the condition the patients come with. Depends on what we dispense. Yeah.
Okay, wow, that's amazing. So, are these things free?
Yeah, we're actually absolutely free. No fee. Everything is free.
Okay.
Right.
So once they come here and they have any, you just give it to them.
We just dispense the necessary
Wow,
medications.
that's nice. So have been the turnout so far?
The turnout have been wonderful. You can see the whole crowd from the queue down here. We have a lot to do right here.
Okay. So what have been the challenges being the pharmacist attending to them so far?
The challenges has been we don't have much chance. The manpower. Let me put it that way. Yeah. From the team here, we are basically just 4 present, 4 pharmacists. So that's just the challenges. Yeah.
That's amazing. Thank you very much. Really appreciate it. All right. Thank you. The program has been really going well. And with me here is the medical CDS president. So please, sir, can you just tell us your name? Just introduce yourself formally.
Okay, I'm Dr. Isomi Olaoluwa David.
Okay, and he is the medical CDS president. All right, this program is really wonderful. Please, can you tell us your inspiration? What inspired you in coming up with this whole thing?
Actually, like you see, my people who are here, we are trained personnel in the healthcare line, and we are also in medical CDS, like you said. Okay. So, and the meaning of CDS itself, the full meaning of CDS is Community Development Service. Okay. So we're here to just reach out to the community, and we've chosen the market community today. And what we have on ground is we have, like I said, medical CDS encompasses people from different professions. Okay. So we have the laboratory scientists, we have the doctors, dentists, optometrists, we have the nurses, many people within the health line. So we've come together with our master resources and reach out to the community in regards to health. So the outreach itself is a medical outreach, and we start with assessing people health-wise. And this actually started with the BMI, body mass index, which involves the weight and the height. So that's the first point. And of course, after assessing the BMI, they go to the nursing station where they take the blood pressure. Okay. And from the blood pressure, they get to see our doctors, which we're going to advise them and give them a talk and health education on what to do based on the parameters they've seen so far. And also from there, they get to move to we have the optometrist over there. Then also from there, they get to move to the laboratory section where they run free tests, and also the pharmacy, which is the last point of duty. And like I said earlier on, it's free. Okay. It's reaching out to the community. Yes. Wow. Thank you.
That's nice. I got to know the batch B put this up together.
Actually, the CDS, NYSC, is everybody that is on ground. There's no batch B, there's no batch A, it's just everyone.
Okay, I was thinking of the special projects. Okay.
It's a CDS project, medical CDS project, so it's for all comp members on ground.
Okay, so being the president, how were you able to put this together and be working with your ESCOs and all this? So how did you come up with all this?
Yes, the success of this has actually relied more on the members. We've been able to pull resources together and also reaching out to sponsors. In fact, my people, they've done very well. They've done a great job because we have to seek out, go out to get sponsors to help us out with some of these materials on ground. So basically, we reached out to sponsors and responded, and that's why we are here with what we are doing. Since we've been trained and we have the skills and the knowledge, so we're rendering the knowledge with their help. So Thank you. That's what we've done so far.
All right. So what have been the challenges you've been encountering so far? Maybe before this and even during the program as it's going on, what have been the challenges?
Of course, organizing a program like this, the main challenge with it is usually funds.
Okay.
Funds is usually a big challenge. Like in medical CDS, a lot of my members are willing to do more of this, reaching out to the community, even beyond the markets. You can get to meet, go into villages and go. In fact, we initially wanted to go to a village, but due to transportation, that's an extra cost of moving us down. So that's why we had to resort to market here. So people just came in on their own to this place. Okay. So fund is usually a main challenge, and I'm taking this opportunity to also reach out to people that are willing to help the community. Because we are here on a temporary basis, but the medical CDS continues.
Okay.
Come members come in, come members go, and the best way the youths, we have the energy and we have the skills also. So reaching out to the community, we just need help in regards to funds to make this possible. That's the challenge we had before coming here, and the challenge when we came here. Initially, we were struggling with tables and chairs, but eventually that was resolved. Okay. It has been wonderful. It has been going on smoothly.
That's nice. So you talked about the medical CDS group putting this together. So is it supposed to be something that should continue?
Yes, sure. It's something that should continue. Like I said, we have personnel across board that are here. So it's like bringing the hospital to the people itself.
Okay.
So it's something that should continue, and of course, many of the people here, they've had the privilege of even speaking with a doctor, having to run some tests, and also to check their blood pressure. Even some of them may not be aware of some of these dangers which they are carrying over now or in their body before now. And it's an opportunity for them to know, and also they've been advised on what to do after this gathering. And what to do subsequently in regards to their health, and they've also been advised on how to take care of their health.
Okay, wow, that's really wonderful. So please, can you just maybe tell us if you've been satisfied so far? Because based on your planning, initial thing that you said, okay, this is what I want to do, and what you're seeing now, have you really been satisfied?
This is a we thing. It's the medical CDS.
Okay.
So,
and you, personal, then general.
Yes, going around interacting.
Comparing with your initial plans.
Yeah. Yes, going around talking with my people during the course of this. I think we've been satisfied delivering a wonderful service here.
So what advice would you have to give to the citizens of this state? Being a core member sent here, and you are serving based on your profession, like helping in your aspect, your professionalism, like in your medical line, supporting them. So what do you have to say to the citizens, and maybe anything you have to tell them?
Okay. To everybody out in Niger State, the thing is that our health is very important, and the prevention is very, very important. I will encourage people to visit the hospitals on time. From the little I've seen so far, people come in with a delayed whatever diseases they have. So they present with late presentation. There's usually late presentation. So and it's even more costly when the complications start setting in. So people should be proactive in regards to their health. They should walk into the hospital, do routine checkup. Just walk into the hospital, do a routine checkup, tell the doctor you want to see the doctor, and just let them run some. If you have a complaint, fine, and if you don't have a complaint, this is something we should be doing regularly. And also, it's also very important in regards to our health. We exercise. For people that don't do exercise, it's very important. And whatever we eat, matters a lot. It goes a long way. So people should take enough fruits, taking a lot of water. Health is very important because health is wealth, and the way we manage our health, it helps us at old age to live well at old age. And I'm sure most of us want to live at old age and still be walking around and smiling and playing with our grandchildren and our children also.
Okay, thank you very much, Doctor. Really okay, this is Dr. Faith, and she's the project manager of the medical CDS. Yeah. So let's have her tell us something about the medical outreach.
Good day. We just organized this medical outreach for the people around. Right now we are in the Kure market, Mina. The main aim of this is to reach out to those that, especially those that, should I say, they are not chance to go to the hospital, or the less privileged, those that are not financially buoyant. So this is to reach out to them, to give them the basic medical attention they need. And if we find out that we can't really reach out to them, as in to complete the medical attention they need, we refer them to the hospital to come see us. Those of us that are working in the hospital, to come see us in the hospital for a complete medical check.
Okay, thank you very much. You are the project manager, and I believe this is a project, isn't it?
Yeah, this is a project, especially by the batch Bs, to at least people should feel our impact before we pass out. We are passing out in.
Wow, that's a wonderful investment. Please, can you tell us maybe your challenges you encountered in putting up this together?
You should know the first challenge, financial challenge.
Okay.
That's the first challenge you face when we're trying to fix it up. Financial challenge was the first one. The second challenge is the one we are facing here right now. Language. There's no way we can communicate to them properly, so we have to look for some people that can really communicate to them, to ask them what their problems are, their health problems, what they are feeling. Some of them can't really explain themselves. Okay. So that's another challenge we are facing.
Okay. I believe projects also entails risk and maybe some things you planned for, uncertainty. So what are the things you didn't plan for that you're actually seeing here and you're amazed? Like
nothing. Wow. We did not even we were even scared that maybe they won't even turn up. But as it stands now, we are in 200 and something right now, and we are looking for a way to stop them from coming.
Seriously?
Yeah, because the things we came with, we are almost exhausting them.
And the people are still much.
They are still coming.
Wow.
We have, look out there, we have more lines. We are looking for a way to cut short the number of people coming.
So I can actually say this is a big success and a wonderful project.
It's a very huge success.
Okay.
Yeah. Wow. Higher than our the expectation we had before coming.
That's nice. So how do you feel now, having put
Happy.
This together?
I like helping people. We are so happy that we are reaching out to those that are let me use the word less privileged, those that couldn't go to the hospital. I think this is a medium to reach out to them. So we are so glad that we met their needs.
All right, thank you, Dr. Faye. It was nice having some time with you. Thank you very much. I know you've had a wonderful time following us on the program Nysc Digest. Sure, you've been enjoying the program so far, and you've actually seen how the medical CDS has brought together wonderful things to actually contribute to the people's life here in Minna. So there are many challenges they faced, even talking about the language barrier, but sure, they've been able to handle it. And also, they talked about the program meeting up to their expectation, even beyond, for they even had more persons than they even expected. So we actually want to say a big thank you to the medical CDS group for bringing this up together, because the people are actually happy for having to bring this to them easily instead of them going to the hospital. Meanwhile, some of them don't even have enough money, and this is actually helping them, giving them free tests, even checking their blood pressure, and even many things. They get to know their health status, and this is really wonderful. And some of them also receiving even free health education, and we must actually say this is really wonderful. The medical CDS group has really done well. See you next time, same station next week. Thanks for watching.